Delhiites as well as people in the National Capital Region grapple with very poor to severe air quality. Concerns over the long-term health impacts have in fact skyrocketed. And joining us today is Dr. M Wali, also physician to former President Mr. APJ Abdul Kalam. So thank you so much for your time here on Times Now. Would you call this scenario an air emergency?
Pathetic, uncalled for, never seen before. This year it's quite high. And we had a conference today with very responsible senior doctors and our head of the Department of Pulmonary Medicine, Dr. Khilnani, who was addressing a FICCI and ITC Illness to Wellness conference in Le Meridian. And I attended that this very morning. And they were of the speakers, including Dr. Harsh Mahajan from FICCI. All the speakers were of the opinion that we have to sit down, join the heads, and do a joint effort to combat this menace. This air is not worthy of breathing. I say a bravery award should be given to those who are surviving this bad air quality. Seriously. Because it is affecting from the root of the hair till the tip of the toe. And there were gynecologists also who said that ladies' fertility, power of producing healthy ovum, PCOD-like diseases, thyroid-like diseases are increasing. And we are definitely losing productive life air. There was a former secretary, Mr. Bhushan, from the Health Ministry. He emphasized on this very point that productive life years to the tune of 11 to 12 years are being lost from everybody's life.
Right. So as you mentioned that today it was decided among the medical community that heads need to come together. There needs to be a sit down over possible solutions. This was also supposed to happen in the parliament today. However, we see that discussion has not happened. The House got adjourned. And what we have now received from the Union Environment Ministry, Mr. MOS for the Environment Ministry, Kirti Vardhan Singh, has said that there is no link between high AQI and deaths and even no link between high AQI and respiratory illnesses.
Well, I may have no right to contradict Honorable Minister, but this is what we are seeing. Previously, when we were operating the chest, the lungs used to come pink. And last seminar, I saw black lungs in the cardiothoracic operation video, and I asked the consultant, you didn't point out the black lungs? He said, ab to aise nikal rahe hain sabke. So that was a statement to me. Because I have been seeing pink lungs during operation when I was growing medical student. And now the lungs which are seen during surgery are black. So you have many cartoons and many pictures on social media which squeeze carbon from the lungs due to pollution. And most importantly, our Professor Arvind Kumar, who has worked at AIIMS at Gangaram, now he is senior consultant surgeon at Medanta Cardiothoracic Department. He says that previously the ladies and males, male to female ratio of the lung cancer was 50 versus 10. I mean 80 to 90% males and 15 to 20% females. Now it is equalized, 50-50. So what is this? We are probably smoking cigarettes in the form of pollution, 10 to 12 cigarettes a day, those who are non-smokers. But he emphasized that among the non-smoker females and the males, the ratio is being equalized. So this is a tragedy. And more couples are losing fertility. There are complications of IVF and thyroid disorders, obesity, diabetes, hypertension. You just saw 2 patients who had no history of hypertension, and one of them maintained record in the diary. He very emphatically said that I am having high blood pressure since I entered this area. He came from a very airy area, Bijnor, a small town where almost not this much pollution. So he was very categoric about, and he was not convinced that he has blood pressure. Right. I took time to convince him.
So we're also seeing, if our video journalists can take a peek at the television screen also here, we're seeing a lot of, in fact, inflow of patients today also at your clinic. So how many of them are coming in exclusively for respiratory illness related diseases as well?
If I ignore those who have learned to live with it, I would say 20%, but 50% of the patients are having symptoms in the form of burning eyes, cough. This cough is not going by routine medication, cough syrups and antibiotics. Cough and decreased lung function, breathing difficulty. One of the patients who was sitting on the wheelchair, he told me, you listened, that he was sleeping in sitting position. So this is the impact. So I would say this is an emergency. Every year we say, even Supreme Court has intervened this year again, that we should join hands and do something concrete.
Right. So finally, what is your expectation out of our parliamentarians as well? They were supposed to take this issue up, but do you think this outright denial, is this going to lead into a fruitful discussion even if it comes up tomorrow?
Adjournment of parliament due to some other reason or denial is not the solution. Parliament is bound to think about it because MPs are breathing same air. Ministers and myself, everybody is breathing, you and me are breathing same air, so we are inclined to do something positive. But the problem is, which I see, we are congesting the cities. Like my house, if I am using air purifier inside my bedroom and my guard is burning coal or wooden sticks to make him comfortable, so it is my duty to provide his comfort, at least to give him a heater. So this is a joint effort. This is a very touching example I have given. We should join hands, and GRAP 4, GRAP 6 is coming. And we have to be very careful on construction. So I was just writing 3 C's. Construction, concrete, coal.
Right.
So all these things are producing pollution. And moreover, there are some particles which are invisible. Those are gases, ozone, and nitric oxide, nitrous oxide, carbon particles, and carbon monoxide is very injurious to small children and elderly. So this is also part of pollution, and most of it is coming from automobile tires, ultra-fine particles, aircraft landings and takeoffs. These are increasing as our population increasing. I use the word, we are congesting the cities. That means our population has also a role to play. So we should be very alert and very disciplined not to produce pollution. We should also join hands. The public should also join hand in Resident Welfare Association. They should promote LPG use, no coal burning. In servant quarters, they burn coal still. Angithi is a good rescue in Jada. तो वो अंगीठी भी बहुत टॉक्सिक है. तो all these things which these common people are not able to afford, we should help them. Actually, it is our duty to help the poor to reduce pollution.
Thank you so much, sir. So this was, in fact, Dr. Wali here, demanding accountability from both our public representatives in this, what he's called a tragedy and an emergency-like situation as far as the air pollution is concerned, and joint action also from the public in terms of self-discipline in reducing our vehicular emissions and other form of emissions as well. With video journalist Junaid, this is Kritika Tiwari reporting for Times Now.